I'd now like to call on Congressman Bera. Congressman Bera has been a physician for 2 decades and joined Congress in 2013 after serving as Sacramento County's Chief Medical Officer. Welcome, Congressman. Back over to you, Bob.
Thank you, Congressman. I first want to relay that the Congressman and I were at a bowling charity event last night, and Joe Crowley of New York was talking a little smack. You had to pick up the spare in the last frame. You picked it up. It was pretty clutch.
Although, Bob, you were the clutch bowler there.
No, but it was fun to see you guys do it. Okay, as Johanna mentioned, you're a physician, as is your wife. How has that helped you in Congress in formulating policies and legislation?
Well, so there aren't that many doctors in Congress. There's 14 of us, and being a physician, you have that experience in the exam room, at the bedside, in the OR, and you put the context of policy in real-world decision-making. So, Washington, D.C. is a town full of very intelligent, motivated 25 to 35-year-olds who are generating policy, but policy doesn't always translate into practice, and I think that's where having that practical experience as a physician can help us shape better policy. I was talking with Congressman Johnson just about how healthcare can be so polarizing. You're a member of the No Labels organization. Is bipartisanship possible in the backdrop of the Affordable Care Act, Obamacare fights? It has to be, right? So, going back to your first question, as a doctor, I don't see a Democrat or a Republican walking into the room. I see someone who has real challenges and is looking for help. So we've got to figure out how to find a middle ground here. And, I look at the current efforts to repeal the Affordable Care Act solely as, going after a political promise that the majority made. We don't have to guess at that, right? Senator Grassley just last week said, there's 10 reasons why they ought to vote against Graham Cassidy. There's only one reason that they should pass it, because they made a promise. So let's actually move past that. There are absolute things that need to be fixed about the Affordable Care Act. If we think about the plan we put forth as the problem solvers, step one, let's stabilize the marketplace, right? That means, making the CSR payments, also doing some kind of stability fund for those catastrophic patients. That's something that Patty Murray and Lamar Alexander are talking about. Second, we think you've got to get universal coverage. You've got to get everyone into the system right now. And part of that is, if you don't get everyone in the system, even if it's in a higher deductible copper type of plan, it's going to be really hard to do the third step, which is really where the cost savings come in, where you start to move towards prevention, better disease management. And again, that's not a Democratic or Republican issue. I will agree with Congressman Johnson that you'll need different solutions in different parts of the country. What might work in California may not work in Ohio, and we can give states some flexibility there.
A lot of Democrats, especially in this session of Congress, have said and co-sponsored single-payer legislation. Is that the answer ultimately? But that's very expensive. It's been estimated $32 trillion over 10 years.
Yeah, so you'll notice that my name's not on any of those bills.
And most House Democrats are on that bill now.
Yeah, and again, I would say that's where, having been a physician, having run a hospital system as a medical director, and having run a public health system as Chief Medical Officer for Sacramento County, if we were starting from scratch, great, you would design a very different system. But what I'd suggest is you can't go from where we are today and just say, hey, we're going to take everyone's health care coverage away and we're going to put you in a different system. What you can do, again, is stabilize the individual marketplace, get to universal coverage, and I think it's going to be difficult for the Republicans to enforce the individual mandate. But, you have had Republicans like Senator Cassidy talk about the concept of auto-enrollment, which, again, just says the default, if you don't sign up for a health plan, will automatically enroll you into a health plan. Again, that could be a copper plan, but let's get everyone into the system. And then third, let's discuss give people individual choice. If they want that option of buying into Medicare, great. But if they like their employer-based coverage, I don't think we should tell them that we're going to take that away and put you into a different system.
Looking at the healthcare system in total, do you see it working well, and where are the biggest improvements needed for quality and innovation?
So we've got a phenomenal system. If you have that heart attack and you end up in the emergency room, we've got great doctors, we've got great technology, and we jump into action. We don't have a great system to prevent that heart attack, to better manage those chronic conditions, the diabetes, et cetera. If we could start shifting things over towards prevention and doing better disease management, you can start to break the cost curve and bring costs down. Mm-hmm.
Speaking of cost, pay for performance has been something that's been going on a long time. Really started with Tom Scully, who'll speak later, when he was heading CMS. How has that changed, and where does that need to go? So we're not talking about volume, we're talking about value.
So, and just reframe that question, the old ways of practicing were the more you did, the more you made.
Right.
And there has been this shift, certainly starting with Tom Scully, looking at the Affordable Care Act, there's some reforms in there, and then looking at the MACRA legislation that we passed in the last Congress, it starts to move towards quality. That absolutely is the right thing to do. So you're rewarded for higher quality of care, more efficient care, as opposed to more quantity of care. And I think that is absolutely the direction we ought to go in.
When you go home, what on healthcare issues, what are the biggest issues that come up? Is it affordability, drug pricing? What are the top 2 or 3?
Well, it's always affordability, 1, 2, and 3, right? So most folks feel like they're paying more and more for healthcare and maybe getting less and less. And again, I think that is the number one challenge. Now, the Affordable Care Act in California actually has been working. We're a state that leaned into it. We aggressively marketed the Affordable Care Act and covered California. We've cut the number of uninsured in the state of California in half. If you look at the risk pool in California and covered California, it actually is stabilizing and rates are stabilizing. So
healthy people are enrolling.
Healthy people and young people are enrolling, and that's because we aggressively marketed it to that group. Now, I was listening to Congressman Johnson. Mm-hmm. While Ohio did Medicaid expansion and so forth, a lot of states have not aggressively tried to get folks in there. So, I don't discount that there are members of Congress that go home to states that did not lean into the Affordable Care Act and they hear something very different. I'd say look at California's experience. We're starting to get better outcomes, starting to stabilize the marketplace. We have a pretty robust exchange. Not to say it's perfect, but there's a lot that the rest of the country could learn from California.
There are indications that the Trump administration is not going to be marketing it as aggressively. Do you think that's going to have a real impact on enrollment?
Absolutely, and that's one of the things that we're pushing them to do. It's like, look, if the Trump administration deliberately undermines the Affordable Care Act, the individual marketplace could collapse. If they don't fund the cost-sharing reduction subsidies, the individual marketplace could collapse. That's going to have ramifications for everyone. I mean, that'll bleed over into the commercial market, potentially in Medicare, and everyone's rates could go up. And as we said, the number one issue right now is cost of care. That's a step backwards.
There have been some, including the president at times, who said, well, let's just let Obamacare implode, and then the Democrats will come to the table, and then they will vote for some type of repeal and replace. Is that going to happen? Well,
what I'd say is right now they don't have replacement ideas. And in fact, I think part of their challenge with the Affordable Care Act is it's built on a lot of conservative principles, right? I mean, it's based off of what a Republican governor in Massachusetts put forth. Now, again, not perfect. There's a lot that we ought to find to work on and fix, but I think we all ought to agree that every American should have access to health care and affordable health care.
Mm-hmm. What should be done about the physician shortage in this country, and what can be done, especially when you think of the aging baby boomers? It's only going to get, this problem's only going to get worse.
It is only going to get worse, and there's an urgency of now. We've got to make sure we certainly are training enough physicians, but also nurse practitioners, physician assistants, pharmacists, so the entire, and nurses, that entire ancillary health force is also aging. So how do we also then start to lean into technology and allow technology to help us better manage patients? When I was dean of admissions at UC Davis Medical School, and I still interact with a lot of the medical students, and when I'm lecturing the medical students, in my mind, the physician of the future is probably going to be sitting at a table with 3 big computer screens. On one screen, they're going to be doing video visits with their patients. On the second screen, big data sets are going to be coming in. The Fitbit already collects a lot of data. That'll be measuring blood pressure, blood glucose, pulse, et cetera. All of that information will be coming in. And again, when technology starts, and you might have the patient's medical record on the other screen, I think that's going to help us address the workforce as well. Mm-hmm. Technology certainly gives us that chance.
As a doctor, you mentioned there's not a lot of doctors in Congress, but what do you tell the non-doctors of what they don't get about being a physician? And I mean, other than bedside manner and dealing with patients, but what do you tell them that they need to know? And what have you been frustrated with, or were you frustrated with before you came to Washington from either bureaucracy or anything else? So
I talked about those really intelligent 25 to 35-year-olds working on policy. Some of them work for me. At the end of the day, though, I've sat in that doctor's chair talking to the patient who comes in and feels a breast lump, and you're worried about breast cancer, and you want to do that workup, and they look at you and they just say, "Doc, I don't have any insurance. I don't know how I'm going to pay for this." That should never happen in America. And I get it. We have limited resources. Let's figure out the best and most efficient way to use those resources. Again, I'm perfectly open that one size doesn't fit all. Different solutions in different states. You've got physician shortages in rural communities, mm-hmm. Physician surpluses in urban communities. How do we? What's frustrating to me as a doctor is everyone's looking for a political win right now, and it's the American patient that's suffering. And we've got to break this gridlock and actually try to solve healthcare.
Speaking of gridlock, the president's 2 most recent best friends are Chuck and Nancy. How do you think this changes the dynamic? Because it's not just one deal where they had the fiscal deal. This has become a trend now where they had a verbal agreement on DACA, but we don't have legislation yet on that. But that is something that's moving, and the president has talked about working with Democrats on prescription drug prices. We haven't seen a lot of action on that. So do you think going into the new year that there could be a shift from the White House that will continue?
I would hope there's a shift, but it depends on what day of the week it is. So I don't fully understand what the president's motivations are mm-hmm. right now, but he's probably been a Democrat more of his life than he's been a Republican. So if he has a desire and intent to actually solve some of these problems, he's not beholden to either party. So I think he'd find that there are folks that if we were going to put the patient first and the patient center, I'd certainly be there working with them.
Do you think that in an election year, though, that there can be some progress on really anything when we're already assessing whether the House is in play and Senator Schumer and Leader Pelosi have said, well, we will work with him on areas where we agree, but then also sometimes they'll get criticized by the left for striking deals with this president?
Look, we're a polarized country right now. You see the country segregating. The coast and the cities are doing fairly well. The middle of the country is not doing great. That said, he's president of the United States. We're elected members of Congress to do what's best for the entire country. And we've got to put country first. We've got to be willing to, if there's a chance to negotiate and help folks that need help. You touched on the opioid epidemic. That's ravaging a big part of the country. We've got to come together as Democrats and Republicans. It's not going to be easy because I get it. When I go home to California, unemployment in Sacramento is below 5%. People feel pretty optimistic about what the future looks like. When that representative goes home to rural West Virginia or rural Alabama, they may be hearing something totally different. we've got to learn how to listen again, and again, recognize that it might be different solutions in different parts of the country and allow that flexibility.
As far as giving patients, really consumers, more information, that's a trend we've seen because you go to the store, you know how much you're paying for this, but in a doctor's office or a hospital, you really don't know what you're going to be charged until maybe later. What can be done in that area?
So consumers now have a little bit more skin in the game because you've seen deductibles go up, you've seen co-payments go up, and I think folks are questioning the value of things. Again, we've seen this trend that moves away from the more you do, the more you make towards higher quality, higher efficiency. I don't think the government's well equipped to say, here's what you need or here's what you need. I think the government is in a good position to say, here's a basic essential benefit that we think every American ought to have as a floor, but then empower individuals to, again, this may sound more conservative, but it's not meant to. Give people that flexibility. If they want a richer policy, if they want better coverage, then they've got that discretionary income and discretionary decision-making skill. But again, I think we ought to come up with a baseline that says, here's what every American ought to have as the baseline.
We will open it up in a few minutes for the Congressman for questions as well. What can providers do? Because in this town, a lot of times it's provider versus provider, and we do have a large debt and deficit, and there's not a lot of pay-fors. They've all been used. So what can providers do to maybe work more in tandem? They're always going to protect what they have, but working more in tandem than kind of always as odds. And certainly we've seen that on a number of healthcare fights because it's all about reimbursement.
Right. So I meet with pretty much every physician group that comes into town since, again, there's not that many doctors and there's only 2 Democratic doctors. I think you hit the nail on the head, Bob. If physicians start with reimbursement and, hey, we're not getting paid enough, everybody stops listening. If instead they talk about their ability to care for their patients, their ability to deliver the right type of care at the right place, that shifts the conversation. Historically, physicians haven't been that politically engaged. Nurses have been much more engaged. You're starting to see a shift. I think a younger generation of physicians that are very politically active and starting to talk about the ability to care for patients. I think the Affordable Care Act got them engaged. But I also think there's that young generation coming out of medical school right now that is becoming much more politically active. So my message to the physician groups would be, don't make this about reimbursement, make it about your ability to take care of your patients.
How have you seen at the ground level in your district the really remarkable story of the politics of the Affordable Care Act has significantly changed where there was never a hope and change message on the Affordable Care Act, and I had friends saying, what's in this bill, and the message was just not very good. And now, as Republicans have attempted to repeal it, the polls have changed.
And we can be critical about President Obama. Once the Affordable Care Act passed, he didn't use the bully pulpit of office to go explain what was in it.
Had a website problem, too.
There was a little bit of a website problem there. President Trump's made the Affordable Care Act reasonably popular. And I think a core value is people recognize, and I think most Americans would agree, that all of our citizens should have basic access to health care. And now that 20 million individuals have access to health care, have coverage, they don't want to take that away. I think they would also agree, I think most Americans would also agree that let's do things to bring down the cost of care, as we talked about earlier. That's where we've got to shift this conversation. Again, the politics and the majority probably don't allow it. And let me be clear, there are a lot of people in our own party that would say, don't touch the Affordable Care Act, it's perfect. I'm not in that camp. There are things that we ought to work on, and we've introduced legislation in the past. There's this health insurance tax that really doesn't add any particular value to the Affordable Care Act. It's an accounting gimmick, and the costs just get passed on to 3-4% premium increases. We've suggested, if not getting rid of it altogether, delaying the implementation until you actually start to bring costs down. I've been yelled at on the floor of the House by certain individuals in leadership for even introducing legislation like that, but it's the right thing to do.
We'll open it for questions if you can identify yourself and then ask your question to the Congressman up front.
Thank you, Congressman. My name is Nicole Braccio. I work at the National Patient Advocate Foundation. Thank you very much for the shout out to pharmacists. In my practice, I've actually come across something you sort of started to talk about where I think it's a lot about how people are changing the culture of healthcare and how people think about it and how that, you internalize that. So for example, I was counseling a patient on an ACE inhibitor for their high blood pressure, and they were also picking up a packet of ramen noodles. So clearly that's an issue, and I don't know how often patients actually confide all of the information they need to their physicians. I think sometimes pharmacists may be more approachable just because we're in the community setting. So what do you think on the back end needs to happen for that culture change to sort of shift, for people to understand how non-medical or even just other factors in their lives affect healthcare and ultimately outcomes?
Well, so I think we have to work in a team-based approach. There are certain things that, the days of one doctor, one patient are long gone. If we're going to bring, we've already brought 20 million Americans into the healthcare system. We're going to bring another 25 to 30 million Americans into the system. We're going to have to work in a team-based approach. There's no need to go into the doctor's office to get your flu shot. Now, a lot of patients now are going in, and the pharmacists are administering that. Years ago, we implemented a Coumadin program. It's been shown pharmacists are actually better counseling patients and managing the Coumadin's a blood thinner, and the incidence of adverse outcomes goes down when the pharmacist is doing it. It took a lot to break the physicians from thinking they were the only ones doing it, but when you showed the outcomes, most people said, okay, that sounds great. It doesn't take away autonomy from the physician. They still have to make a decision to say, you ought to be on that medication, but once that decision's been made, there's a lot that the pharmacist could do. Nutritionists, are better at counseling on what foods that diabetic should be eating and not eating. Again, doesn't take away from my autonomy as a physician. I still have to make the diagnosis and recommend treatment, but then once that plan is in place, there's plenty of folks that have more experience, more education, or better at managing that. So it's changing a culture. I do think the younger generation is growing up in these patient care teams and much more open to it, and technology also is going to assist that.
Any other questions? I did want to talk about, there's one in the back.
Hi, I'm Roxanne with the Healthcare Leadership Council, and I just wanted to ask, Congressman Johnson mentioned that, there haven't been very many innovations in the recent times. I wondered if you agreed with that or if you thought there had been healthcare innovations, and if so, what some of those were.
I think healthcare is constantly innovating and remaking itself, and maybe, again, that's my California perspective, because I think we're constantly trying to reinvent the future, but I think it's happening in Ohio as well. He touched on telemedicine. In my home district, I was visiting one of our hospitals, and there's an orthopedic surgeon who was doing a video visit with a patient who was post-op hip replacement, who lived 40, 50 miles away. There's no reason for that patient to actually come into the office, drive in there for a 5-minute wound check. The orthopedic surgeon could look, Skype with that patient, say, get up, walk over to the room, come up to the camera, let me see your wound, and ask some questions. That's better for the patient. They don't want to drive all the way in, and that's better for the doctor. It makes it a lot more efficient for that physician. So that's simple innovation. Now, the other things that we really have to lean into is we've spent billions of dollars on electronic medical records. The problem is there's no interoperability. They're not speaking to one another. They're siloed. How do we create that interoperability? How do, the technology's there. It's not technologically difficult. We just have to start, breaking some of these monopolies and getting that information flowing backwards and forwards. The amount of healthcare information that is being collected, again, I use Fitbit as an example, but all of that big data is coming in. How do we make that accessible to the physician and allow them to use that data? the patient's not going to have to come into the doctor's office on a regular basis because, again, most patients don't want to do that. We're going to manage a lot of that care at home. So healthcare hasn't disrupted, or technology hasn't disrupted healthcare the way it has so many other aspects of our lives. That is coming, though.
Mm-hmm. The one thing you don't hear a lot about Washington, but you mentioned this town is very polarized, is that Medicare is headed for bankruptcy. And Congress has not significantly extended the solvency of Medicare since the Balanced Budget Act of 1997, which is 20 years ago. That's going to have to be addressed at some point. And do you think that it will be done like most things are done at the last possible second?
That would be a shame, though, right? Because that urgency, you've got a population that's aging.
Yeah.
I understand that, talking about Medicare is politically a challenging issue, but talking about tax reform is a challenging issue. Talking about the deficit's a challenging issue. You ought to expect us to have the courage to engage in the difficult conversations. It's easy to do the easy things. Anyone could do those, the non-controversial things. You ought to expect us to have difficult conversations that require some political courage and some political risk. And political courage is lacking in this town right now. And I'm one to say, let's talk about those things. And I don't think you can do Medicare reform in isolation. Kudos to Erskine Bowles and Alan Simpson for trying to tackle some of these big issues. Yeah. We probably have to do it through some sort of commission like that. And I think it was a shame that we didn't actually debate SimpsonBowles.
Because you think it could have, had it been pushed harder, maybe some of it could have become law. Well,
it would have been a difficult conversation, right? You saw President Obama not even embrace his own plan. And I get it. I've had millions of dollars of commercials run against me because I thought at least it was a gallant effort to do it. We've got, if we want to break the gridlock, we've got to have some political courage to engage in the difficult decisions and understand that it's going to take Republican ideas and Democratic ideas.
Are you concerned that some pragmatists like Charlie Dent and Bob Corker and possibly Susan Collins will be leaving Congress?
Absolutely. I mean, I think, the solutions to big challenges aren't going to come from the far right or the far left. If you want compromise, we're a diverse nation, we're a segregated nation, and politics have become more divisive. If we want to come together as a nation, it's going to take people in the center who have that willingness to cross over. Shout out to Charlie Dent. I mean, he has exhibited political courage, as has Bob Corker and others. And maybe this is Senator McCain's moment as the elder statesman. Well,
we've run out of time. Please thank Congressman Bera, and I'll hand it over to Johanna. Thanks so much.